Hello, I'm Dr. Prem Kumar, Consultant Neuropsychiatrist at Penang Adventist Hospital. In conjunction with World Mental Health Day, I would like to share some thoughts on bipolar disorder. Bipolar disorder is a state of varying poles of mood, hence the term bipolar. And these states of mood can swing from a manic phase, which consists of someone feeling too happy, having racing thoughts, increased levels of energy, talking too much, and being irritable, to an opposite mood state, which can consist of a depressed phase. And this would be characterized by loss of interest, sadness, feeling hopeless, having guilt, and sometimes suicidal thoughts. The two main types of bipolar disorder are basically bipolar disorders type 1 and 2. Now, when a person's ability to function is affected, or when there are psychotic features such as hearing voices, feeling paranoid, or even having grandiose thoughts, which can occur in half of people with bipolar disorder. This is then known as a bipolar type 1 disorder. However, when those high phases are less severe, it is then called hypomania, and this type of alternation with depression is called a bipolar type 2 disorder. Yes, it is frequently missed, as it is often confused with a psychotic disorder. Now, we have to remember that this illness begins in the late teens and often with a preceding depressive episode. But if it's prolonged and not responsive to treatment, we should consider bipolarity, and we treat that initial depressed phase with antidepressants. It can cause a switch to mania. Now, this illness is generally hereditary, but it can be treated. And when someone is well, patients are mostly back to a normal life. However, relapses can occur if there are psychosocial stressors or if compliance to medication is questionable. The outcome is good if it is treated early. Treatment consists of a combination of mood stabilizer and a neuroleptic medication. And a trial of stopping or tapering off treatment after a year is usually attempted. Antidepressants, as mentioned earlier, are not indicated unless in certain cases of depression in bipolar type 2 disorder. Well, the complications of manic phases can include self-medication, that is, using alcohol or illicit drugs to calm themselves down or to help them sleep, sexual promiscuity, or brushes with the law. In depressed phases, suicide can be a risk, and hence why seeking treatment is essential. Being a common illness, we should strive towards eliminating the stigma that's attached to this disorder so that more people will come forward to seek treatment.